Welcome to Better Cybersecurity, the ISF podcast. I'm your host, Steve Durbin.
ISF Chief Executive Steve Durbin is an expert in leadership, business culture transformation, and cyber strategies for today's top enterprises. I'm producer Tavia Gilbert. Today, we bring you a very special episode of the ISF podcast.
Welcome back to the ISF podcast. Now, if you're a regular listener, you'll know that this show has always been about more than just the technical dimensions of cybersecurity. We talk about leadership, we talk about culture, trust, resilience, the things that determine whether organizations and, importantly, the people inside them truly thrive. And it's in that spirit that I'm particularly pleased to introduce today's episode. It's March 2026, Prostate Cancer Awareness Month. And we're marking the launch of a genuinely exciting new partnership between the ISF and Prostate Cancer Research. Today's podcast is probably a little bit different, but still hugely relevant to cybersecurity, and I'll explain why as we go through. First of all, let me just give you some statistics about what we're talking about. The topic we're talking about today will affect 1 in 8 men. If you're a black man, it will affect 1 in 4. The topic we're talking about causes over 12,000 men a year to die in the UK alone. That's probably about 1 every 40 minutes. So pretty much by the time we've got to the end of this podcast, somebody will have died. The topic we're talking about is increasingly common. It's becoming one of the most commonly diagnosed cancers in men in 112 countries around the world. That's more than the countries where the ISF is active. The topic I'm talking about is prostate cancer. And I'm absolutely delighted today to be joined by Oliver Kemp. Oliver is the CEO at Prostate Cancer Research. Oliver has been the chief executive there since 2017, and PCR is a charity dedicated to advancing groundbreaking research into diagnosis, treatment, and care to create a future where prostate cancer no longer threatens lives. Oliver has been playing a central role in the transformation of the charity into a dynamic, patient-centered organisation known for driving pioneering research and innovation, championing access to testing, treatment, and really tackling long-standing health inequities which are so common, sadly, today. Under his leadership, the charity has grown significantly and is now one of the fastest-growing charities in the UK. Oliver was also awarded an MBE in 2025 for his contribution to prostate cancer research and care. And today we're going to be talking about prostate cancer, the symptoms, and importantly, who's at risk, how diagnosis impacts the working man and indeed, importantly, those around them, and exactly what we can do about it. And I'm very proud to say that the ISF has joined forces with PCR for a 2-year partnership to focus on raising awareness of this particular disease. Oliver, you're very clearly committed to empowering those affected by prostate cancer. Tell me more about what PCR is doing to ensure that every man diagnosed has access to the best possible care and outcomes.
Thank you, Steve, and thank you again for the partnership with ISF. PCR has been around for over 30 years, and traditionally we've focused on making sure we have new research coming through, so new diagnostics and new treatments in order to make sure that we've delivering the best possible outcomes for men. But more recently, we've also moved into making sure that we work on equity, so making sure that there isn't a postcode lottery, but also making sure that we influence government to do the best possible job for prostate cancer patients and try and reduce those horrific numbers that you just mentioned.
So let's just make sure that everybody's got a pretty solid foundation here in terms of what we're talking about, because many people certainly in the ISF network of cybersecurity and IT professionals and perhaps beyond may not have thought deeply about this topic before. It's a little bit taboo. It's not one of those things that you're probably going to go down the pub and discuss with your mates. So tell us, Oliver, what is prostate cancer and what should we be looking out for?
Prostate cancer is one of the most diagnosed cancers in men. It causes 12,000 deaths a year, and it starts off in the prostate, which is a walnut-sized object, which is down in your nether regions, and it's often more common in men over the age of 50, and particularly the average diagnosis age is around 64. It's obviously not very dangerous when it's in your prostate, but when it breaks out of your prostate and starts spreading around the body, it becomes incredibly dangerous. And as we've seen with people like Sir Chris Hoy, as soon as it gets into your bones and into other organs in the body, it can be fatal. Certainly if it's diagnosed late, it very often is.
Yeah, I mean, you mentioned there the age of 50 as being almost the magic number. There are people, though, who are being diagnosed a lot earlier than that, aren't there?
Yeah, I mean, Chris Hoy's a good example. He was diagnosed at 47 and just had his 50th birthday this week, actually. But there's certainly men who are diagnosed in their early 40s. In fact, at the weekend, I was at a screening event and they found a 40-year-old man with a PSA that was off the charts. It's very good to catch it early, and obviously you save a lot of years of life if you catch it at 40 and it hasn't moved into the rest of the body.
You mentioned PSA there, and we've mentioned that a couple of times already, but there may be some people listening to this who really aren't familiar with that term. What is PSA?
PSA is the first line of check for prostate cancer. It's the first diagnostic test that run on people. It's a simple blood test. It can be done in a few minutes. It costs a few quid. You go in and see a nurse, they take a blood sample, they take it away, and they see whether there's prostate-specific antigen. So that's bits of break-off of cancer that are starting to spread around the body. And the PSA test is just a way of checking how much PSA is in your bloodstream.
In the past, certainly, I remember PSA having a bit of a bad rep and people not really wanting to put themselves forward for it because it would potentially lead to all sorts of other things in terms of the investigative work that perhaps was unnecessary. But things have improved significantly, haven't they?
Yeah, so I think PSA, it generally catches about 6 and 7 cancers. So It's a very good test for finding cancers, but it can often find things that aren't cancer. So it's a first test, and nobody should have a prostate taken out with just a PSA test, thank God. And in the olden days where you used to have a PSA test followed by a digital rectal exam and then your prostate taken out, you could have a lot of overtreatment. And overtreatment is when you have surgery and you don't have prostate cancer, or you have any form of treatment that doesn't have prostate cancer in it. So these days, thankfully, we've moved to a very different pathway. And the pathway, as recommended by NICE, which is the body that recommends all treatment across the UK, says you should have a PSA test, followed by an MRI scan, followed by a guided biopsy. And that is a really good way of reducing overtreatment and overdiagnosis.
And of course, the important thing is to try to catch this thing as early as possible, right? What we don't want is to leave it, as you mentioned, until it develops into something like a stage 4 where it's metastasized. And there's parallels here with the cybersecurity industry, which I do just want to pull out, because we talk so much in the industry about the cost of late detection in cyber. And the analogy almost writes itself. This is a threat that develops silently, often shows no obvious indicators until it's significantly advanced. And the value of early detection in security is something that finally boards and business leaders are starting to really get their heads around. And really what you're describing there, this need to catch things early, this need to really understand what I would probably describe to people within our community as the threat landscape, and to make a risk assessment. It's exactly the same calculus, isn't it?
Yeah, and stage 1, 2, and 3 of prostate cancer, you're very, very likely to get a cure. You got 100% chance survival at stage 1 and 2. It drops a little bit for stage 3, and at stage 4, it drops to less than 50%. So at that point, you've got a terminal illness. Exactly as you're saying, we catch it early, it's cost effective, it's less dangerous for you. You've got a whole plethora of options, of treatment options, and hopefully it'll never come back and you'll live a happy and fulfilling life. You catch it late, you've got a very different experience. And like cybersecurity, I suppose, you don't want that situation, and spending 4 quid on a blood test and 10 minutes with a nurse to check that is probably a good use of your time.
Yeah, absolutely. And I think one of the reasons that I was so interested in the work that you were doing is that if I look at it from an ISF perspective, we have something like 40,000 users around the world. A very significant proportion of those are men. A large percentage are 45 and upwards. And so they fit exactly into this category that we're talking about, where testing should be something that you do without really even thinking about it. And as I say, that was one of the reasons why I was so keen for us to get involved from an ISF standpoint. And it is very sad that such a simple test, which can identify a disease at such an early stage, if caught at the right time, is perhaps being, for a lot of people, left to chance. And that really is a detection failure, and it has profound consequences, doesn't it?
Certainly, and we see huge differences between the different parts of the country and different types of social demographics. It shouldn't be left for somebody to A, know where their prostate is, B, know what prostate cancer is, C, know your risk, and then start going out and asking for testing. That should be something that you get a letter through the post and say, this is the time for you to go and get tested because it could save your life. And doing so would save thousands of lives across this country. early detection is absolutely the key. We also reduce pressure on the NHS. It's £150,000 per person per year to treat prostate cancer, and that doesn't vary very much depending on where you are in the world.
That's a huge number, absolutely huge, for something that costs, as you said before, next to nothing at all. And it's certainly one of the reasons why at the ISF, for all of our employees, the company actually funds PSA tests now for anybody who wants to have them. Because I think you mentioned when we were talking beforehand, you gave an instance of somebody who'd been refused a PSA test by their GP. Does that happen very often?
Unfortunately, and I think, of course, lots of GPs have been trained 20, 30 years ago when there was huge harms. If you have a PSA test followed by a digital rectal exam, it's a very difficult way of finding prostate cancer. If it's on the other side of the prostate, which is a round ball, you're not going to find it. Yeah. So that there were huge harms, and therefore GPs are reticent because they've been taught in an era where there were harms. And nowadays, with that diagnostic pathway that we're just discussing, the harms are far less than they used to be. And that means that more GPs should be recommending testing, especially for those with a family history or those who are black, where there's 1 in 4 chance.
Yeah, it's about being proactive, isn't it? And for our listeners, in cyber and IT, men are used to being proactive. We're used to assessing risk. We're used to acting early. We don't wait for a system to fail necessarily before we investigate. And really that same instinct should apply here, I would say.
Yes, and I think us men are not always the best at going and looking after ourselves, and we often need to be nagged to go out and do something. But if you've got prostate cancer, it's going to get you one way or another, and it'll gradually grow inside of you. And it's far better getting it early and having a relatively simple procedure, which you can now be in and out of hospital in a single day, rather than late-stage prostate cancer, which will have very different consequences.
And certainly if I think about my own experience in this, I was diagnosed, back in September 25. The route into it was pretty much as you described. I had no symptoms at all. And my PSA was simply picked up because I'd asked to have some cancer checks to be done when I was doing a fairly ordinary, standard well man. And my PSA came back. It was absolutely sky high. And in fact, it was so high, I thought it was a mistake. But following on from that, then certainly the pathway you've described is the one that I followed. Yes, I did have an MRI. Yes, I did then have a biopsy, which confirmed the diagnosis at stage 3. So I'm just sort of under that stage 4 cutoff. And you do go through, I suppose, moments where you wonder what might have happened if you had not done that test at that time.
And I'm sure for your family as well, thinking actually, like, if this had broken out of that prostate and started spreading around the body, or you'd done that test a year later or put it off, like, the consequences could have been very different. I guess, how do you feel about that now? And I suppose wanting to make sure that other people don't end up in that position.
I think I am in a very fortunate position of being able to take positive action. I mentioned before that we've instituted this program within the company where anybody can have a PSA test and we'll pay for it. But I'm very keen to try to raise awareness of it because I think I was very lucky. I was very fortunate to catch it at that point. And I think some of the things that I've discovered is that part of the challenge with prostate cancer is not so much the physical. It is actually the mental and the emotional. And both of those are things that men are not great at dealing with. And I think it's also worth us just mentioning that this is not a disease that affects solely men, because a lot of men will have girlfriends, wives, they'll have sisters, they'll have mothers. Those are all affected by it. It's a pretty all-encompassing disease when you actually get into it. And because I think there are some pretty significant mood swings that you go through, some of the treatment, particularly in things like hormone therapy and so on, does change the way that your body works. In my case, I've got a little podgy belly now, which I didn't have before, which I laugh about with my consultant because I spent a lot of time in the gym trying to sort of keep it all down. And then suddenly I got on some drugs, of course, and there it is. So we laugh about that. But that is a hugely important piece of it as well, trying to bring some humor into it and trying to get a perspective on what you can control versus what you can't control. And you have to be somewhat accepting and trusting of the people that you're working with. Prior to this, actually, and it's recently gone out, I did do a podcast with Martina Navratilova where we talked about cancer in general. And one of the things that Martina was talking about, which has stayed with me, was the need to build a team around you. The right team, whether that be the medical team, whether it be the support team in terms of family and so on. For anyone listening to this who also has prostate cancer, that's hugely important if you haven't gone down that road.
And I think we see really significant differences between the outcomes of people who are in a relationship and have the right team around them, that the clinical nurse specialist happens to be somebody who's really careful and thoughtful and looks after you, and people who don't have that access. And for sure, I think the NHS is often absolutely brilliant at the moment where you need surgery or need brachytherapy or one of the other treatments available. But sometimes our budgets are limited, and that's the same across health systems across the globe, that often we don't look after the whole human being. We treat the cancer itself. The National Cancer Plan launched last week talks about exactly the same thing. We have to make sure that we treat the whole patient, because often 65% of people with cancer have another comorbidity of some sort or another disease. So treating the whole patient makes a lot of sense.
No, absolutely. One of the other things I think that it is worth mentioning for people listening to this is that prostate cancer, as we said, can affect people from age 45, 50. They're still in work. It's exceptionally challenging to fit all of this in, isn't it?
Yeah, for sure. I mean, I was with a patient just a few weeks ago. He was an accountant. He ran his practice alongside 2 or 3 other accountants. He was diagnosed early 50s, and he's struggled ever since. The treatment was quite severe. It was stage 3 moving into stage 4. It meant that he lost his practice. He had to sell the business at a reduced rate. And for somebody who'd been successful in his career, suddenly his wife is taking him to appointments and struggling to bring home the bacon as such as well. It's incredibly tough just at the moment when you're starting to save up for retirement at decent levels and all those types of things. You hear stories of people losing their houses and not being able to keep up with their mortgage repayments and all sorts of things. So yeah, financially it's a burden too. And sometimes it depends on your employer. Lots of employers aren't ISF and they're not looking after people having PSA tests and all those types of things, and they're less thoughtful about it.
That's obviously not something that we can address, but I think it's something that people just need to be aware of, which again reinforces the need for early testing, early awareness. You don't need to go through all of that if you can catch this thing early, because in the very early stages, stage 1, stage 2, it's a relatively simple thing to treat, isn't it?
Yeah, and I think one of the great things about the partnership and the work we're doing with ISF is that we're trying to catch these cancers early.
Yeah.
We're making sure that lots of the diagnostic testing is done at a really high level. It's beyond what the NHS offers. We're bringing in an additional what's called a reflex test, which also tests like a biomarker alongside PSA to make sure we find the most aggressive cancers and we treat them really well. This partnership allows us to test the very best of diagnostics on a population that is underserved and often won't get tested.
And I think the other thing, just reflecting on being in work with it, is that certainly in my experience, it tends to focus the mind. And there is a version of resilience that we talk about in cybersecurity that is particularly relevant. It's that ability to absorb a shock, continue functioning, not let something become a collapse, a breach, or something like this. And personally, I think I found myself applying that same level of thinking. Maybe it's instinctive, I don't know. I've tended to try to compartmentalize, to keep going, to focus on what you can influence. But also, and this is hugely important, you have to be honest with yourself about what you can and what you can't manage alone. And again, I think I'm very fortunate at the ISF to have an exceptionally good team of people around me who are clearly aware of the situation and are more than ready and willing to help as and when necessary. And again, I recognise that's a very fortunate position for me to be in.
Yes, and I think we see that across the country where people don't have that kind of level of support and they don't have a team around them ready to step in. And yeah, it's great that you have people ready to step up to the plate.
Now, to the partnership a little bit, Oliver, I understand that we're the first non-life sciences organisation partnering with you to raise awareness and embed this sort of critical learning and thinking about prostate cancer. How will this partnership that we've set up help and make a difference?
As we were just discussing, I think one of the great things about this partnership is, first of all, we're aiming at people who often don't get tested.
Right.
And there are lots of PSA tests happening across this country, but they're often focused on regional areas. So the southeast of England, London has lots of testing. It has lots of the best hospitals in the world, whereas other parts of the country don't have access to that. And therefore, the current system of informed consent, going to your doctor saying, I think I'm peeing through the night, I can't empty my bladder properly, I've got blood in my urine.
Yep.
that system does not work, and it means that there are huge inequities. The National Prostate Cancer Audit that came out a few months ago showed exactly that we have really significant differences depending on where you live in the country. This partnership, first of all, will be aimed at areas where lots of PSA testing doesn't happen.
Right.
Then it will make sure that when the PSA testing is happening, we're going to go through that additional step with that reflex test that I was talking about, that additional blood test. Then it'll go back into the NHS with MRIs, guided biopsies, and if necessary, then treatment. So that system of working alongside the NHS, alongside other commercial partners, and delivering something with your support and with the ISF support means we're able to not only make sure we reach the most vulnerable people, but also give them the best testing possible to make sure they don't have overtreatment and we're treating the cancers that are aggressive and need treating. So it's absolutely breakthrough. Nobody's done anything like this before. We're also going to collect all the serum, the blood, the plasma, and use it for making sure we test new diagnostics so that we can continue to improve those diagnostic tools that are being used to find prostate cancer right across the globe.
It's fantastic. I was particularly interested by some of those more advanced things, and that was something that stood out for me in the way that your charity operates. It's really looking beyond the standard elements. It's really trying to break new ground in this sort of area. Certainly some things I've talked about to people within the ISF is that we're looking to really try to help make people understand that they can have an informed and empowered choice as to what the different stages are. And we're running different webinars around that, including topics like standard diagnostics that we've talked about, talking a bit perhaps about different treatments, decision-making, how to get the best out of a conversation with your healthcare team. That's hugely important in my experience.
Yeah, for sure. And if you talk to the clinicians, they'll say that sometimes people will come in and they've got a nice list of questions. They know what to ask. They're prepared. They go along with their partner or an advocate on their behalf. And those people almost universally come out with less treatment regret 10 years down the line. Like making a choice just because you hear the word cancer and, okay, I'll jump to the first option is not a good way to approach it. But those people who come in armed with the right questions, wanting to understand what the side effects will be of all the different treatment options, and really getting down to the nub of what they want to have later in life. Do they want to make sure they're not incontinent? Do they want to make sure they're not impotent? Or do they just want the cancer removed? And that'll often depend on your stage of life. You're 75, you probably could be less concerned about whether you're impotent or not than when you're 45. So it makes a big difference depending on who you are and the conversations you have with your clinician. Absolutely.
So it's all about being informed, isn't it? And there's also, I think, an element where technology can help, isn't there? We're thinking about AI and some of those newer things.
Yeah, I mean, we fund early stage startups, and one of those startups, for example, is an AI technology. It's a company called Lucida. And what it does is it looks at the scans of the prostate when they come out of the MRI machine and literally circles where they think the cancer might be. Obviously, if you're a radiographer and you've seen 100 scans and it's Friday afternoon, then your ability to spot cancer, having worked the entire week, goes down. In fact, for a junior radiologist, it's down to 62%. With Lucida's technology, that jumps back up to 83%. So you can imagine the difference that makes trying to find cancers. You suddenly got a lot of people walking out of a room thinking they don't have cancer who do.
Yeah. And I think the AI point there is worth dwelling on for our audience, because it does capture something that I find particularly compelling about why the ISF and PCR belong in conversation. The machine learning techniques being used in prostate cancer diagnostics, multiparametric MRI analysis, for instance, pattern recognition in imaging data, they're all methodologically very close to the anomaly detection work that sits right at the heart of modern cybersecurity. Federated learning, which allows institutions to collaborate on AI models without sharing sensitive patient data, was pioneered partly in security contexts. So lots of overlaps, and all of these fields are developing in parallel, solving similar problems. And perhaps the expertise of some of our members can help in this, because their expertise and insights into cyber resilience is not irrelevant to the challenge of trying to improve some of these cancer outcomes. The insights that they have into trying to detect threats, we're talking about pretty much the same thing, the way in which we use technology. You know, as I was thinking about this, it felt like exactly the kind of probably unexpected connection that makes a partnership like this genuinely interesting and not just symbolically important.
Yeah, and I think a lot of those great ideas come from places which you wouldn't expect. I think that's exactly true. I mean, I think for us to be learning how to develop MRI tools that are based on cybersecurity, great innovators are spotting opportunities across a variety of different fields. And I think we've got some really great entrepreneurial startups that we support. And if anybody has great ideas about how to improve the systems, then we're always all ears.
That's fantastic. Before we end this discussion, Oliver, I just wanted to ask you, what are the top 3 things that listeners who've sat through this, what are the top 3 things they can do today if they're worried about prostate cancer or just unsure?
First of all, if you've got symptoms, if you're listening to this and you're thinking, I went to the toilet quite a few times last night, I can't empty my bladder properly, find that you've got blood in your pee, then make sure you go and see your doctor and try and get a test. They should be offering it to you at that stage wherever you are in the world. Yeah. So simple PSA test. Second of all, we're working on trying to get screening approved at the moment. We have a petition trying to go through Parliament. Please sign up. We are absolutely certain this will save a lot of lives, tens of thousands over the next 30 years, if approved. Please go there. But also, we're always all ears for volunteers to get involved. And I think, just as you said, there are opportunities for us to learn from other sectors and to be engaged with professionals who often have much to offer in a whole variety of contexts.
I think that's right. And I think one of the things I would say, having been through quite a few of these different processes that we've talked about now, is don't be embarrassed. You really have to leave that aside. You're talking about something that sadly is very common. 1 in 8 people, 1 in 4 if you're black. And you've just got to do it. And at the ISF, we talk a lot about resilience as a value, not just for systems and organizations, but also for the people inside them. And that absolutely has to include their health, which is one of the reasons why we're working together in this partnership.
I'm going to ask you, Steve, when you start talking to people, are you finding that people are opening up to you and having conversations about their own diagnosis, or people in their families who are finding that men are a bit better once you open up those kind of conversations?
I would say yes. There is a hurdle that you have to get over. I think that, and it is an important point that you raised, because very few people, in my experience, really know how to respond to you. First of all, if you tell them that you have prostate cancer or any form of cancer. And so there is almost, I would say, an onus on the person with the cancer to, and this may sound strange, but to put the other people at ease, to let them know that it's absolutely okay. I tend to say, when I do talk about it, people will always say, I'm sorry to hear that. So it's fine. Thank you. And then we get on to talking about some of the things in a bit more detail. But it is something that I'm passionate about for a variety of reasons, clearly because I'm going through a particular process. But also, as I've been involved in it, it has really come home to me that there are so many things that people can do to avoid being in a situation like I am. My cancer, as I said earlier, is a stage 3. If I had been involved in testing a lot earlier, then it might have been caught at a stage 2. It might not have. And you can't dwell on that side of things. You have to take a very positive approach. You've got to be very positive in your outlook. But I think you do also have to be very proactive about your own health. And for people in cybersecurity, it's about being as proactive about your own health as you are about protecting your organization. So it isn't about waiting for symptoms. I didn't have any. Book a PSA test. We've said on this show, it's a very low cost. And the people that I've come across who've certainly taken that step, and sadly there are more of us than people might think, all tell me the same thing. And as for partners, families, friends that are listening, don't underestimate the power of your encouragement. Just being there. That's really important. You don't have to do anything big. It's just a quiet conversation that could genuinely help. Lots of things, I think, for people to take away from this, to actually think about. And I would say, yet again, if you happen to be male, if you happen to be over the age of 45, if you haven't had a PSA test, go and get one. It's dead simple. And I'm talking about that as a needle phobe and somebody who's stayed away from doctors for many years. And sadly, I'm spending more than a huge amount of time with them. I'd really rather not. But there we are. So, Oliver, thank you so much for taking time to talk to us today, sharing some of those really valuable insights. And I'm sure that our listeners have got a whole range of different things to take away from this, not least the fact that they're all going to rush out now and book PSA tests and check whether or not their dad, their brother, their husband has been tested.
Yeah, thank you ever so much to yourself and to the whole ISF for all of your support. It's truly groundbreaking that we've got to this point, and I can't wait to see the results of making sure that we get those new diagnostics up and running.
Fantastic. Thank you, Oliver.
Thank you.
Thank you for listening. We'll be back next week with more expert insights and thought-provoking discussions. But in the meantime, if you really enjoyed today's episode, please take a moment to rate, review and share the podcast. If you're interested in becoming an ISF member or continuing the conversation further, please do get in touch with me at steve.durbin@securityforum.org, or indeed get hold of me on LinkedIn. And remember, you can explore all our media and resources at our website, securityforum.org.